Hey, everybody. My name is Theresa Nguyen, and I'm the Chief Program Officer at Mental Health America. So I oversee MHA's programs, including MHA screening, and I also oversee our research, which looks into how we use peers in the system and also largely the use of technology to support people at the earliest stages of their recovery process. And certainly very interested in how we use large scale data to provide insight into gaps. For supports across our country. I am a licensed clinical social worker as part of my work and what I bring to MHA, and have spent the last 15 years just working as a clinician and an educator and an advocate. But today I am here with Dr. Neil Leibowitz, a psychiatrist and an attorney. And the chief medical officer at Talkspace, which is a medical technology company that provides online therapy. Yeah. So, in his role, he oversees the quality of care provided by therapists and psychiatrists on Talkspace, and he received his MD from New York Medical College and his JD from NYU School of Law. His bachelor's is in economics from Johns Hopkins, and you were previously a senior behavioral health medical director at United Healthcare and a faculty member at Albert Einstein School of Medicine. Is that right? Neil also teaches now health law at St. Francis College and is on the board of VIP Community Services, which is a large federally qualified healthcare center in the Bronx. Super cool. I love it.
Well, thank you for having me, and I hope I didn't intimidate you with a couple of letters at the end of my name. I know very little and just a little about a couple of the things. Hopefully, I'll be able to share some of those with you today.
Awesome, definitely. And I mean, honestly, Neil and I have worked together. I met you, asked me to come with you on a conference call, and we had so much fun. So I'm just glad to have you back in this capacity and have you share a little bit of what I've learned as part of your work with our community here today. Yeah.
Ready. I'm
Let's
ready.
dive in. Okay. So the first thing I'm just curious about is I know a bit about Talkspace, but I'd love for our network to just hear what you feel like is the most interesting insight that you've gained since joining Talkspace.
I'll tell you a little bit about what Talkspace does for those who don't know, and then something interesting that I definitely encountered. Talkspace is a mental health technology company. We provide therapy and psychiatry. Many ways it's traditional and video based. Schedule a video with a therapist, pop on at the appropriate time and get care, or a psychiatrist. But the other way which we provide treatment is something called messaging therapy, where you choose your therapist, and instead of having a set video time, you're going to message your therapist, you're going to send them text, audio, or video throughout the day, and they're going to respond several times a week. So we've taken that 45-minute appointment and broken it into little bits, not necessarily in real time, where you're communicating really 5 days a week with your therapist. What's interesting about that, as a traditionally trained psychiatrist, as many of the clinicians in the audience are, when I first heard about this, I definitely hit the pause button, said, can this work? Is this for real? And as I learned about it, it became very interesting, and really about how people get their care is how they want to get their care. We've tried to solve for that notion that the most common number of sessions someone has in mental health is one. And that's a problem that's plagued mental health really for decades. People come in and they leave, whether it's they didn't like their therapist or psychiatrist, whether it's they felt that they weren't mentally ill, maybe they didn't like their treatment plan. How do we solve for that? And the part that was most interesting to me was that people on the consumer side, so people seeking care, actually wanted this long before the research community, the payers, employers really caught up with the notion that this is something that can really help people. was there were thousands of people at the time who said, hey, I want to try this. I want to get my mental health this way. And many of them stuck, and not just for one session, but some of them at this point have been getting care from a therapist in the way for several years. And that was really amazing to me.
It's totally true. Because of COVID, I've had to start all my therapy sessions online. And there are a lot of things that I've heard just like from my friends who are also in therapy that we can get kind of stuck in these moments where I either like seeing myself on camera and that's fine, or some people have been like, I hate the fact that I can also see myself and now I feel utterly anxious about the fact that I'm also staring at my face. I will just say personally, I've really enjoyed that I can just show up, and because I've been in therapy forever, I'm just like, whatever. I've eaten a meal with my therapist and she's like, okay, this is a first. I'm watching you eat a chicken leg. And I'm just like, dude, I'm going to be so hangry if I just don't. So this is the best use of technology and being able to show up. Right. But in terms of, you're a psychiatrist in your training. So as someone who is the provider on the other side, who also works with the technology, what's your advice on the flip side about the ways that we as users or as a client, like I'm a client, right? How do I prepare myself to get the most out of using a platform like Talkspace to reach a therapist online?
So, first, don't have your session while driving. True story. Okay. So, number one is really go into it with some sense of this is how I'm going to get my care and I'm going to do it safely. But aside from that, it's really about having an open mind into what treatment is and how is it best going to work for me. And for many years, decades, we focused on treatment in terms of this is how we offer treatment to people. And there's been a more shift of that balance. So for some people, it's going to be face to face. And I think that that's great. And then we're going to return to face. And for some people, it's going to be flipping on the video screen at a set time. For other people, it's going to be this asynchronous modality where I'm sending messages to my therapist throughout the week and I'm not going to do appointment based. For others, if we expand the box, it's going to be I work with Calm and I use that app, or maybe I use it in conjunction with my therapy. And giving people a choice within a range of what people need, right? Someone who's obviously having thoughts of harming themselves, giving them Calm is not going to be appropriate. But within a range of most people, it's finding what works for you and your own balance, and then finding the right person. And one of the interesting things that we've found is that opening up the telehealth world allows someone to find a therapist who's a fit for them. If you live in Alaska and you're looking for a therapist that is Muslim, it's going to be pretty hard, especially if you live in a small town in Alaska. Maybe in the state, there's now the option. Maybe as under COVID, there's been emergency licensure, and we've broken some of those barriers, and maybe we'll get to talk about that a little later. And now you have the ability to find someone, A, with an expertise in what you need, whether it's military issues or trauma, or a type of therapy that maybe you think can help you or works well for you, or just really a granular fit and a match with someone who can identify with you and you can bond with at a level that you really haven't in the past.
That is so true. I do often find that one of the most challenging parts of finding a therapist or doing therapy is finding a therapist. And sometimes we feel like it should just happen, and when things don't click, then you just feel really bad, and this is why we stop therapy. So the fact that Talkspace offers kind of a marketplace for you to test things out is a really interesting concept, that I think that in the world of telehealth is going to shape the way that people think about how to initiate care. That's super cool. So I think there will be a lot more to see and to come as we grow this experience for users, right? You touched on an issue around, that technology gives us the option to find a therapist who doesn't live in our state. But I know from our advocacy work or policy work that that's a challenge, like cross state care is an issue. I'd love to kind of turn our attention to that direction and just hear more about what you see in Talkspace in terms of an advocacy or a policy change. What changes in policy have you seen during COVID, maybe, that have the biggest impact on access to care?
The bane of my existence is a giant spreadsheet that has regulations for all 50 states for psychiatrists, nurse practitioners, psychologists, social workers, mental health clinicians, marriage and family therapists, and on, each broken up by state and sometimes broken up by over 18, over 13. So that's the regulatory landscape we live in. And in a way, it hasn't caught up with telehealth. So I live in New York. In my bricks and mortar practice, someone who works in New Jersey can come see me. In the telehealth world, if they live in New Jersey, they cannot see me on screen. Okay? My license has to match up with their state of residence. So it made a lot of sense back in the day where state medical boards really needed to protect people in their state. You didn't want that doctor from Texas who had 15 botched surgeries coming to New York and now being able to operate on you, or that therapist who was providing poor care doing the same thing. In today's world, we've broken down the barriers through technology, and we've seen this with COVID, with allowing for cross-state practice. And we've used this in Talkspace, and I've used this in my practice a bit as well. And at the end of the day, from what I've seen and the data that I have, and also talking with some of our congressional representatives in their offices, we haven't seen this implosion, people getting really bad care, malpractice coming up. So we have this complex regulatory web, and it's really turned into an impediment. And going back to that Alaska person, they can't find a therapist in New York or Washington or California, where there are thousands and thousands of therapists with every specialty, with a better demographic in terms of minority therapists. So if they're looking for someone who is that Muslim therapist, that may not exist in their realm or easily findable in Alaska, but it is in California and it is in New York and many other states. So that's sort of regulatory piece number one. And then regular piece number two is a lot of the rules surrounding who can even have telehealth. So Medicare and Medicaid were both, I would say, behind and did not have an expansive telehealth policy. So people who had Medicare may or may not have been able to get their care via telehealth. Medicaid was also not as strong. In some states, it wasn't accessible. And we've brought down many of those regulatory barriers. And right now, where we're at is access to care is enormous. And the patients, the clients love it. And the truth is almost every provider who I've spoken to, be it therapist, psychiatrist, physician in all fields, have loved it and want to incorporate it. Maybe not 100% of their practice, but want to keep this as part of their practice.
Yeah, that's really so true. I think of a lot of the missed appointments that I might have had because something came up in my life, and then I have to calculate the fact that I have to drive to my therapist's office as a factor for ending up canceling an appointment. But it would be so different if I could call or just get on to a camera and just start and initiate therapy in that one moment. It would probably save on a lot of missed sessions, right? Um, but you've discussed a couple of changes, and I know that we've had a lot of policy changes related to telehealth since COVID. If you had to pinpoint into one particular change that we've seen recently that probably needs to stick, what would you say is the one policy change that needs to stay?
I mean, to me, it's really a no-brainer. It's allowing across the United States people with US licenses to practice across the United States. At the end of the day, my medical degree is my medical degree and my specialty is my specialty. It doesn't change if I have a California license or a New Jersey license. So there's no real training differences. The doctor you get with those licenses is the doctor with those same skills. So finding a way to allow for broader access to people in rural communities, people in states that have real shortages, to me is a huge value proposition. It's a win for clients, it's a win for physicians, it's a win for therapists. All around, everyone wins. And yes, there are some things we probably want to put in place before we do that. We want to make sure we have proper monitoring, that maybe there is reporting, so we keep some of those state rules and regs in place and make sure people are following them. But I think it's really imperative that we work towards finding the right way to do this safely, ethically, and relatively quickly.
Yeah. It seems like dismantling 51 states plus territories on destroying their state regulations would feel very hard, but I don't know why it wouldn't be totally feasible to create a national registry of providers who want to enter some kind of federal process for then providing cross state treatment, especially around telehealth. So there must be a will to make this
Well,
happen.
interestingly, there is something called interstate compact for medicine, where some states have agreed to accept licenses from other states. It's
Okay.
expanding, it's getting there. I can't tell you exactly how many states, but it's probably high teens at this point, maybe even over 20. And there is movement. What's interesting is I am not aware of that similar movement for any of the licensures that we spoke about earlier in the therapy arena. So, in a way, medicine, physician, not tooting my own horn here, but medicine is a little more advanced here and has realized the value. Not all states, and there's a lot more work to be done. But the therapy community, and it's probably in part because there are so many different licensures and groups involved, is actually behind. And when you think about what's a more natural fit for video based care, for telehealth, it would be mental health because it's really the one specialty where you don't have to touch the patient. You don't have to have a stethoscope. You don't need an EKG as part of your routine care. So it would really lend itself. So it's a little disappointing that us as mental health practitioners are actually a little bit behind the eight ball rather than at the forefront.
Dude, you're so right. It's true. And if we can't come together to make this happen now, we probably definitely should. So, outside of COVID, we've been wrestling for the last 400 years with understanding race equity issues. You touched on the needs of Muslim community members looking for treatment. Have you seen things change? Are we better at serving people who are currently underserved populations? What's your sense of where we need to grow or what's happening in this space? There's a lot of questions I just asked you, so you can basically share whatever you want.
I'll pick and choose. We're better, but we're nowhere near where we want to be.
Okay.
We've spent a lot of time looking at our network and our makeup of really race and gender. And ultimately, there's not enough work being done at the educational level, meaning that I believe the statistics are something akin to 20% of the therapists represent minority, and that's all minorities inclusive. And the demand is higher than the supply there. And there's a large to male ratio. So again, there's more demand for male therapists, primarily by men, than there are supply. So first is we have a lot of work to do from really an educational standpoint and driving people into these fields, making it available, accessible, affordable for them to enter. So we really can have that cultural competency as an industry. We're focusing on building out our network, but we're working with limited supply. So any therapist who joins our network and says, I can see 20 clients or 20 less clients they're seeing elsewhere because it is limited. So I think that's A. B is I think that there's a lot of work and training to do really to work on people's cultural competencies. It's an area I've tried to work on as well, and I definitely want to do more work because it's not always about if I am Black, I need a Black therapist. I need someone who can understand and help me, and maybe help me with my depression. So having a broader sense of cultural competence across the entire community of therapists, I think, is very valuable. And we focused on both increasing our network and also increasing the training that we offer to the therapists in the network surrounding these groups and issues to try to really offer more expertise and, really a broader product of therapy and psychiatry. But there's a lot more work to do, both for us and really for the entire community.
Yeah. If you had to think about where your largest gaps are in terms of providers, what are some of the qualities that you find are the hardest, or the biggest gaps that you need in terms of a provider network?
Um, that's a great question. Increasingly, the transgender world, because the number of therapists is very minute, there are some people with expertise there. But as you start to move past this notion that sexuality was either gay, straight, and moving into a broader definition, recruiting there has become important, and the community hasn't caught up in terms of numbers. So that's definitely a focus. And really, broad-based minority. But the hardest part for us, honestly, is in a lot of those states that traditionally don't have large minority communities, but those communities exist, finding enough therapists to serve the demand. So
Yeah.
whether it's Alaska, whether it's Hawaii, whether it's Idaho, I'm not picking on specific states, it tends to be really hard to build out that network. So to the
Mm.
extent that it goes back a little to what we spoke about previously, is if I'm able to tear down the walls and allow my New York and California, where I feel like we do a pretty good job with supply and demand, to cross into the places where we're just struggling from a bandwidth and our network is a little more bland or doesn't offer the breadth that I wish it did.
Mhm. It's so true. And you say transgender community, and right off the bat, all of the data that we have from our MHA screening program screams that our transgender community has an immense amount of need. And it's really not surprising to me that that was one of the first populations that popped up to you, as the hardest then to fill in terms of that gap in care. So we're coming to the tail end of our time together. I'm so sad. Um, I think we should close out with last thoughts on how people can get connected to you, because we have a network of people who need treatment, but also providers and advocates. So, how should we get connected to Talkspace?
Easiest way, Talkspace.com on the web. But more importantly, I want to speak broadly. We do a lot of work in the content arena, education arena, whether it's Instagram, Facebook, all those social media things, which I kind of missed the revolution on. I think I have a LinkedIn account, that's about it. But on all those things, we're active, and there's a lot of material that really you can learn about mental health, learn about issues, get involved, advocate. So all those things sort of are in our ecosystem. If you need care, of course, we're there. If you provide care, of course, we'd love to have you. But really, from a broader sense, I look at it as one of our missions and goals is to provide education and support to people. Not everyone who needs to see a licensed professional. It's really for everyone and people who just want to learn more about some of the issues that they may be dealing with, family, friends, loved ones, and especially in a time like this where anxiety is at an all-time high and mental health needs are an all-time high, it might be a great time to really educate yourself.
Totally. Thank you so much, Neil, and taking the time to speak with us today. Thank you, everybody online, for watching. And I think what we're going to do is be back in a few minutes with more programming.